According to government, the NHI would be implemented this year, governed by the existing national insurance scheme. The implementation minister says it would be every Grenadian would have access to better health care and necessary specialized care they might not have afforded otherwise. A walk through the streets of St. George revealed that some are of the view that the process should have been implemented years ago. Meanwhile, there are others who are totally unaware of the proposed plans.
I think it's really interesting from the perspective of a young Grenadian. As with many things, I mean, you hear so many things about the persons having issues with the national insurance scheme, and now with this national health insurance, persons have many questions. And as a young person, you're being told that you're mandated to register, but you still want more information as to exactly, how is the process going to work? How is it actually going to benefit you as a person if you register? How much you have to pay? How long do you have to pay for it? Do you have to? What about unemployed persons? I mean, that's something that unemployed persons are asking. Persons who are self-employed as well, they want to know, how does it benefit me as a self-employed person, and how does it benefit me as someone who's employed? You have the retirement age, which is like 60, 65 in some cases. So there's a lot of questions, and I think from the perspective of a young Grenadian, that's what we want to know. We need more information before we've been told by the powers that be that we have to register.
It's a fantastic project that is long overdue. People who went to England in the 40s and the 50s could attest to the benefits of a national health insurance scheme. And if we are talking about love for country and love for people, that is an absolute necessity.
Well, I'll say it's good in that it'll benefit the workers and other ordinary people.
I cannot speak on that. I don't know nothing much about the national health insurance.
I think it's a good thing because basically what you have is people just coming in and just getting free health services all the time. But under this new health insurance, people will be paying to be putting money into the entire system so that we could buy new products, new stuff so that we could all use, like new machinery, new testing equipment, so we could be up to par. Because I mean, just for instance, just the other day we got a decompression tank. We should have had it long ago. If they had the health insurance thing in place, we could have had this like 10 years ago, and people would have been. There are people that have the bends, and it's just horrible because you have to fly all the way to Barbados and come back, and that's a lot of money. But if you have it here, it'll be good.
And you think it would be beneficial, especially for our tourism industry, since we push tourism?
It will, because there's also a thing called medical tourism. So if people come, if we up our game, people will come here, and they will pay money to get thing. Because when tourists come here and they go to the casualty, after the doctors see them, they say, where do I pay?
With government making final preparations for implementing a national health insurance, the passing of the legislations must be finalized. The government, meanwhile, maintains this is not about politics, but providing a better healthcare system for every citizen. Renee Toussaint, GBN News.